All right, well, here we are.
Here we are.
Yeah, it's good to see you. Lori and I were kind of sad backstage that we didn't prepare a dance for you all, like a choreographed dance, because yes,
totally.
It would have invigorated the afternoon.
Last act of the day.
Yeah, so we have that on deck if you all want. We could do it impromptu. It's great to talk to you. I'm really inspired by your story, so I'm just going to jump in. Yeah. You wear a lot of hats at Memorial Hermann, so can you give us a quick snapshot of your company and your role there?
Sure. Well, it was a lovely introduction. And so you heard we are very large. We are actually the largest employer of Houstonians. A lot of people don't know that. So we're 34,000. We are a fully integrated health system, meaning we have everything from hospitals to outpatient to physicians to urgent cares. And so we also have a health plan. So we are very large. We are very much mission driven. We are nonprofit, so we are the only health system in Houston that is actually community owned. Okay. So there are no shareholders. We actually give back to our community to the tune of about $500 million a year in community care. So it's a tremendous, amazing place to be. Mm-hmm. My role is the Chief Human Resource Officer, and so with that comes the usual cast of characters, right? Total rewards, TA, organizational development, employee relations, employment law. A couple of things that are maybe a little bit different is we have a change management department that reports to me, and chaplains report to me. Oh. So we are healthcare and we have chaplains, and so chaplaincy reports to me as well. We also have what I would call a centralized float pool of about 1,200 caregivers that report up to me that then fill in for people if they're on FMLA or on vacation or calling sick or those kind of things. So we actually manage that central staffing as well.
A lot of hats.
A lot of hats,
yeah.
Yes. I'm hat rich.
Yes. So since your role connects many departments, like you just noted, from your viewpoint, how would you say the role of HR managers in general has changed over the past recent years? And what opportunities exist today that, say, didn't pre-pandemic?
Yeah, I think if you've been in this field, this profession for over 5 years, you've seen tremendous amount of change in what is asked of human resources. I think during the pandemic, what we really saw was all these problems that companies didn't really know that they had, or they were just emerging because the world was seeing them. People were looking to HR to say, what do we do about? Right? What do we do about mental health? What do we do about wellness? What do we do about resiliency? What do we do about burnout? What is the rule? How are we going to figure out when people wear masks and when they don't wear? I mean, and HR was looked to for that. And so what I think that gives us an opportunity to do now is to prove that we are more than just the traditional functions of HR, but we are true contributors to the business who can think on our feet and can problem solve in real time. Yeah. And I think it's been fantastic.
Right. So in that vein, Memorial Hermann has noted that it's transitioning from a degree-centric talent management approach to a skills-based organization. So what does that look like from a process standpoint, and how do you move people forward?
Yeah. So I'm so glad that you asked me this, because if you are in HR and you've gone to a conference in the last year, you have seen something about skills. Skills. All the technology is skills. All the AI is skills. And I think what you have to do is step back and think of, do you have a problem you're trying to solve, right? And what is that problem? Because skills is just by itself is just one more thing to add to the list that confuses everybody, right? So for us, our problems were a tremendous workforce shortage of nursing in particular, but healthcare workers, incredible burnout, people trying to get out of healthcare after COVID, but also this real lack of understanding and clarity about what career development could look like in healthcare if you wanted to move around. People think doctor, nurse, physical therapist, right? Yeah. But they don't think about all the other things that there are in healthcare. So we wanted to provide that visibility. And then the other thing was pay transparency, right? So we may never in Texas be regulated for pay transparency, but a lot of these national companies, Career Builder, others, they have sort of national rules that they have to post pay ranges, right? And when they post ours, they're wrong because they use their algorithm and we don't share our pay ranges.
Right.
And so we know that we're going to have to get to that place where we're more transparent. And when we looked internally, we thought our jobs were a bit of a hot mess, right? I don't know about many of you guys, but they're developed over time, and you know, people want to have this one person who needs this one job description, and they really want to put them in a grade 16 because it pays more than a 14, right? And so we had a hot mess of jobs, and we said we never can get to pay transparency or clarity around career development with our jobs looking like this. So then we said, well, if we're going to look at all of our jobs, let's not just look at it through a traditional lens. Let's also figure out what skill sets we need. Okay. Right? Let's not just look at job duties and what experience you bring to the table, because the world is changing so fast. People don't have, I mean, where are you going to get somebody with 10 years experience in AI? No. Yeah. That doesn't exist, right? So you have to think about, what do you need people to do? So we said, okay, let's figure out how ready we are. So we hired a company to come in and do a readiness assessment for us to say, how close are we on pay transparency? How close are we, if we wanted to be totally transparent, what would we need to do? And what do we need to do about our jobs? And how clear do people understand how they can move? And they came back and said, you're about halfway. So we said, well, let's start with the jobs. So in terms of process, what that looks like is we have 2,200 jobs at Memorial Hermann, 2,200 different jobs. And we needed a framework. So we sat back and created a framework that consists of job family group, job family, career band, career level, mapped all 2,200 jobs to those and found out where we had gaps. So for example, what we found in our corporate offices is we had very few entry-level jobs. So our corporate departments were like, yeah, everybody has to have at least 2 years of experience. So we had no entry-level way, right? So I didn't even have a college path for people to come into. And so you find things like that you can fix. But then we said, okay, go in, we're actually working with Towers, and they used AI to scrape all similar jobs across the country with the 10 most prevalent skills attached to that job and the 10 most emerging skills attached to that job. So now not only do we have updated job framework, now we have the skills that we need at the various levels, and we also have what is happening in the future for those skills. Wow. So now you have that, you've got this framework, you can be very transparent about it. People can see, and I'm going to show it all. You want to be a P3 and now you want to be a P4 in this particular job family. Here's what it takes. Here's the skills you need at this level. Here's the skills you need here. And then you can think about all the different talent development approaches that you can use, right? I could hire based on skills. I can promote. I can develop based on skills. I can use skills for succession planning. I can look at a talent marketplace and use skills to pull people onto project teams. So once I have that skill taxonomy, it's limitless in terms of how I could use those. Now, what I do want to say is that in no way do I expect Memorial Hermann is ever going to just get away from degrees, right? I have 14,000 of my staff as nurses. You have to have a nursing license. You have to have a degree to have a nursing license, right? We're never going to do that. But we are quickly looking deeply at, do I really need a degree for everything? And if I need a degree, do I need a master's? Or what is that I really bring, especially if I have the skills that I can demonstrate? So it's a journey. We think it's probably 3 years. We're about a year in. We think it's probably 2 more until we sort of really have our legs under us. You got to get the board involved. You got to get your CEO on board. You have to tell your leaders early, right? There's a lot of the buy-in and change management that you have to do too. But I think we got to get there.
Yeah, I'm excited to hear in a couple years from you about how the workforce looks and how people are, being hired in ways that are a little bit more attuned to the needs of the organization, and really what are the metrics based on all this work, because it really does sound like a massive transition.
It is a massive transformation. It truly is. And that's why I say you just really have to be you have to have a problem to solve that you're willing to do the hard work to do, because there's going to be people who go, I don't like this, I don't want to do this. So you have to be willing to stay the course and know that your board has your back, that your CEO has your back, and that it's the right thing to do to solve the problem that you have.
Right. Yeah, I feel like I could keep talking about this for a while because it's fascinating. I know there's a couple other things that you're interested in kind of sharing with the group. One is, when we talked earlier, we were talking about Houston, the very dynamic city with vastly different groups of people. So what is one central area of need that Memorial Hermann has noted in the health of Houstonians, and how are you engaging and retaining this group?
Yeah, so I would say that each year as we do our strategic plan, our human capital plan, I do what I call an environmental scan. So I look around at what's happening around us, what are other companies doing. And it's been interesting over the last 4 or 5 years to watch the demographics of Houston just rapidly change. And if you look at it now, go on Greater Houston Partnership website and look at the demographics, and if you can go back a couple of years, you can just see what's happening. Aging population, really double digit growth in the Hispanic population. It's really fascinating. But in particular, one of the things that I'm noticing is that at Memorial Hermann, our population is aging. So I've watched it over the last 3 years, and it's gone from an average of 40 to about 40.9. So about a year, but still in 3 years, that's a pretty rapid rate. And the average age of our nursing is in the mid 40s. So if you think about what is that going to mean, right? And then the demographics of Houston, if you think at Houston, about 10,000 people turn 65 every day.
Okay.
So the population of 65 plus is going to be our biggest population.
Right.
It is. So then you have to think about, well, what am I going to do to retain that group? Because I don't want to lose that knowledge, and I don't have enough coming up. I don't have enough humans coming up to replace this. And so what we're thinking about is a few things. One is, do I have the employment models that are going to attract and interest somebody who certainly doesn't want to work at the bedside anymore, because that's hard. So do I have other jobs for them? I know they know what those are. And do I have training to get them in those jobs? But do I have employment models? So for example, central staffing, right? So I have this labor pool now. Could I create a part-time or supplemental retirement attractive role that maybe is some combination of unique benefits? Right? Healthcare benefits is huge. It's expensive. But could there be a package that attracts people who maybe don't want to work every day, but maybe they want to be there to give back knowledge, or they want to do something that's interesting and fun, but they want to be able to kind of set their own schedule. And is there some model that works for them? So those are the other things. Obviously, other things with benefits, right? Bright Horizons, elder care. We're thinking about retirement vehicles. We're thinking about, we have a personal concierge service that we offer to people that can help people navigate, life. We have on-site personal counselors. So a lot of things just to make sure that the workforce has resiliency models built in, if you will. Those are just some of the things we're thinking about.
Right. Because it's interesting because also, we kind of talked about that you are a healthcare system for the public, but you also provide health care benefits to 34,000 people.
Yep.
So how are you all navigating that?
Yeah, it's really interesting because I can see it from both sides. And I actually have an operations background. I used to be the chief operating officer in a health system. And so I can see both sides of this in terms of understanding how we provide healthcare and what's happening in the pricing on that side, right? The cost of our medicines, the cost of our supplies, the cost of labor is just tremendous. Meanwhile, regulation is just pounding, right? So there's all this pressure to provide healthcare. And then you've got the people who do that work also need healthcare. And sometimes those people think, well, I work at a hospital, this should be free, right? Like I should get this for free. And so helping people understand what that really is, and I shared this, for those of you who are here in benefits, my heart bleeds with you because it is so incredibly expensive. I mean, it is going up, the price of benefits is going up crazy, and I would argue that we are going to be at the point very soon where we are actually unaffordable. To give you a sense of scale for us, 2 years ago, my benefit budget was $300 million. Last year it was 330, and next year it'll be $405 million. So imagine that level of spend. I mean, that between 330 and 400 is generally what I spend on merit increases. So at some point, is your company going to have to start making those choices? Like there has to be, we have to have an answer to this, which is part of why I love working in healthcare, because we can see it from both sides, right? And I can see if I pull this lever, does it have an effect over here? It's fascinating, but it is one of, I would say, the biggest challenges that we face as really in the country right now is health benefits.
So, we've been talking throughout the day about these challenges and transitions. So what are some of your key messages that you share with managers and leaders in this large organization that you're in to help motivate them during these times of transition? I mean, you as their leader at the top.
Yeah.
What are your messages?
Yeah, absolutely. So what we try to do, and what I try to do all the time, is remind people that this is a noble profession. And we do this because it's important and it's critical. I'm famous for saying we're not making peanut butter here, folks. Like, we're taking care of people's lives.
Right, yes.
And what we do is so incredibly important to this community. And our work is directly related to how healthy, not this generation, not next generation, but for generations and generations to come. And so try to remember we're playing the long game, right? Take a breath. Yes, it's hard, but you are in an incredibly important role. What you do is incredibly important every day. It matters to people. So stay the course. Yeah. Right? Yeah. And it's easy to say that because it's true. Right. And so I think connecting people to the why, we talk about it all the time.
Yeah, just showing them the impact, but also I think I mean, your passion is very obvious.
I've been told that.
Yeah, well, I say it as a high compliment because, leaders, a lot of leaders can't get there without passion and an ability to communicate that. Yeah. And that's really, it's contagious in a good way, right?
Well, thank you.
So yeah, I mean, and I love that. We're not making peanut butter. Y'all are literally saving lives.
Right.
I say quite the opposite sometimes. I'm like, we're not saving lives here, but
right.
We're talking about it. But
Our chief physician, this is funny, is Dr. McCarthy, and he'll say often, this isn't rocket surgery, folks.
Rockets or brain science.
You're so weird.
Yes.
Yeah. But I mean, because sometimes it is brain surgery.
Absolutely.
Right? It absolutely is brain surgery.
Yeah. So I want to end on a meaningful note. What has been some of the most inspiring aspects of your job in the recent years?
I think seeing people come together, and I hate to keep going back to COVID, but I do feel like it was a pivotal point.
Absolutely.
I feel like culturally, for good or bad, it was a pivotal point. And in the healthcare industry, we came together to do things that we were solving problems that were coming in the door left and right.
Right.
It was rapid fire, decision making, precision. People were exhausted and tired, but boy, they came together. Yeah. For the community and for each other in ways that I think changed the fabric, if you will, of the organization and what we believed we could do. And so I now find this incredibly passionate, empowered workforce that they're like, we can do that. We can do that. Look, if we did that, we can do this, right? And there's going to be bumps and bruises along the way, but the dedication that I saw during that time and that I continue to see has been the most inspirational thing for me. And from an HR perspective, I would say the influence now that we're able to have on the business, the ways that our leaders are looking at us to influence not just the human capital strategy, but business strategy. And I would say if your leaders, or you're in an organization where they're not looking at HR for that, I'm going to say something very controversial, which is find you another organization where they do. Right? Because one recruiter asked me that. Well, Lori, what if you should interview for a job and HR didn't have a seat at the table? I said, I wouldn't take that job. Right? I mean, there's too many places that's the case.
Right.
And so, find a place that values you for what you bring to the table.
Right. I mean, the word human is right in there.
That is right.
And
it's right
they
there.
need to have the human, expert at the table.
Yeah.
Yeah.
I always tell people, when you guys are talking about something that doesn't involve people, let me know.
Yeah.
Right?
Right. Yeah.
So.
Yeah. Well, it's been a joy to talk to you. Thank you so much. I've really enjoyed this.
You as well.
I'm sure our audience has too. So let's give Lori a hand, please.